Welcome to HCRF Talks COVID with Dr. Platanias. This is week 2 with Dr. Platanias, and we're so fortunate to have him here to share his expertise and insights about the COVID crisis. Hi, Dr. Platanias. Thank you for being here.
Thank you. Thank you, Nicole. Nice seeing you.
Now, we're also happy to have Eleni Boussis and our HCRF board members. Thank you and welcome to all of you for being here.
And thank you from me also, of course, for being here and for everything you do. We are very grateful for your support. I don't need to repeat it every time, but we're extremely grateful. I want everyone to know. So.
Now, we're all here because of the foundation that we created. We started this foundation because we wanted to make a difference. We wanted to save lives. Today, every city, every country, and everyone all over the world is thinking about saving lives. Just like all of you, I think it's unbelievable that we're in the middle of a pandemic. For me, it's been 45 days that I've been following stay-at-home orders, sheltering in. I'm not going to lie, it's been really difficult. I have 3 little ones under the age of 6. We've been juggling homeschooling, Zoom ballet, Zoom karate, trying to manage and have some kind of order in the house. Just like everyone else, we're trying to disinfect everything and anything that comes into the house. And I think the worst part of it all is not knowing when this will end. Despite the craziness that we're living in, I can't stop thinking about how other people have it more difficult and how much more difficult it is for them, especially cancer patients. I think it's actually so amazing to think that just a few months ago, we were all together at our Navy Pier Gala celebrating and providing hope for cancer patients. I think that we should all be so proud that as a young foundation, we've accomplished so much, and we have to keep that momentum going. I think the way that we're meeting today is not ideal, but it's inspiring that we've come together, and we're here because we know that we're going to get together soon in person, and we're here because COVID won't stop us from caring about cancer patients. Last week, Dr. Platanias, I think it was so inspiring and encouraging from you to hear that things are moving in the right direction with this COVID crisis. An interesting topic that came up was this idea about COVID patients generating antibodies and antibody testing. This has been in the media quite a lot lately. Last week, the WHO announced that there's no evidence that COVID patients are generating antibodies and suggesting that secondary infections are possible. Can you help us make sense of this, and what does it mean for everybody and the possibility of developing a vaccine?
Yeah, so first of all, in terms of antibodies, there is no clarity yet. I don't think science knows whether the antibodies that are generated will be what we call neutralizing. So antibodies do get generated. The question is if these antibodies will be strong enough to prevent a secondary infection, and how much does it need to be there for that? So that's unclear yet, and I think that's what you're referring to the WHO, that we don't have confidence to know this moment that anyone who generates an antibody, and there are many people who generate antibodies now all the time, but to know for sure whether they are prevented, that protects them from a secondary infection by the same virus. So this will take some time to be sorted out, but we know one thing, that from some patients who recover from the virus, then people go and take plasma and reinfuse it to other patients who are very sick. And it seems some patients are improving, which means that, there is something there, probably antibodies against the virus, that can have some activity. So, but we just don't know if this applies to all the people, some people, if there is a number of, an amount of antibodies that needs to be there to see this reaction. And that's why it will be important to follow up the outcomes. We at Northwestern and the Cancer Center specifically, we participate in an effort of the National Cancer Institute working together with the National Institute of and Infectious Diseases that Dr. Fauci chairs, and they're trying to test different serum to develop new antibody tests. And we've been sending them samples. We are part of there are other cancer centers in the country that also participate. So I think these answers will be addressed at some point, but there is still not clarity, although there are already private antibody tests out there.
And do you think there's value to do an antibody test right now? Should people that have had symptoms in the past?
I think that's an individual choice.
Mm-hmm.
You know, I don't see any downside if someone wants to do, but that's there is the caveat that we don't know how great all these are so far, and the specificity and sensitivity. They are not, you know, they're going through a process now to get FDA approval. So it's probably, if someone can get an antibody, it's, you know, it's not, it could have it. The question is, we don't know exactly how good each of them are, but they have gone through a process and they are probably to a certain degree reliable. So
Well,
I don't think it, yeah, go ahead.
No, I was just going to say thank you for that. And I invite everyone from the board to join in if they have any follow-up questions to that or other thoughts or questions for Dr. Platanias.
The window, the hospital one or the other one? Yeah.
Can I ask a question, please?
Yeah.
Yes, Eleni.
Well,
yeah.
I'm done with that.
Oh, who is asking? I'm sorry. Can you just say your name so we know?
But you know, it's not that, because I feel like people kind of don't take it as seriously. And I guess you've got to be confident enough in your own creative ideas not to worry about that, not to worry about whether everybody likes it and stuff like that. I mean, I look at what Maggie does, for example, and everything she does is different, and some of it is outlandish. I mean, it's, you know, and it's just so creative. And I think the way to be creative is to say, screw it to what other people think. And it,
Who is that? Who is asking the question?
yeah.
Can you open the microphone to Eleni?
It was about.
Yeah.
Okay, can everyone hear me?
Yes, yes.
First of all, I just want to say thank you from the depths of my heart, Dr. Platanias, for your hard work. I know your commitment is to cancer, and now you have committed yourself in trying to find a resolution and a promising drug and a vaccine for this horrible virus that has crippled the entire world. So thank you to you and to all first responders and to the people that are in the front line in dedicating their lives for ours. Second of all, I want to thank the board, the members, everyone for joining forces with us with this wonderful Q&A that we're getting direct information from you, who is one of the leading scientists in the world. Third of all, I want to thank Nicole. Nicole, you should have been a doctor, honey. You're amazing. You're such a
happy to be here.
Thank you so much for asking all those, I think, all those promising and really challenging questions that we all have, because as you said in the beginning, we're all locked in and it's close to 2 months. And as my family says, it's so hard to keep me tied down to my house, and I am ready to just start flying.
Please don't do that.
Dr. Platanias, yesterday, the whole world was speaking about the promising drug remdesivir. And also Oxford gave a report this morning, along with some other promising research centers across the world, about the promising vaccine that did wonders with SARS. And they say that it's the same vaccine that was used 100 years ago. Can you please go into a little bit of depth about the vaccine and this drug that hopefully will block this deadly virus?
Sure. Thank you for the question, Eleni. So first of all, let's start with the drug. This drug, remdesivir, is a drug that was developed originally to fight the Ebola virus. If people remember, a few years ago, there was this Ebola epidemic that was completely catastrophic, but it was not widespread. So, but it didn't work well for Ebola. It was not working. And then the company that is developing this drug, Gilead, brought it to clinical trials. There was some evidence, some suggestion that may work against this coronavirus. So there have been trials right now around the world. Our Northwestern is participating. We are one of 2 places in Chicago. And in fact, we have been part of this, what we call randomized trial, that patients who are very sick from coronavirus get either remdesivir or placebo, because, you know, unless you do that, you will never know if something works or not. And if you've seen the news yesterday, Dr. Fauci was talking about that there is some activity of the drug, that there is a statistical p-value in shortening the time of the disease. Still is borderline for survival effects. It was not, there was a trend, but it had not reached the strong value that we want to make sure that it makes people survive more than the ones who don't. But clearly there is some activity there. It looks like this drug is working in part. So that's a very important big step, because that's the only drug at this moment that we have some evidence that it really is working. It's not going to be like a magic pill or a magic injection that will take the disease away, but it's a very first step. And if you go back in history, I remember when I was a young doctor in New York, I was training during the peak of the AIDS epidemic. And those days there were no drugs at all. And then there was a drug that came first called AZT that was having some activity, but it was also toxic. It was not great. But what happened is, because they realized one drug was working, then this was expanded, and then the drug was optimized, the chemists got there, they got different drugs, and now AIDS has become like a disease that is easily controllable by a mixture of, you know, drugs. So this is a very important first step, because it shows that there is a drug at least that has activity. And I think it may lead now, there are also many other trials going around the world right now with different drugs. And we'll be getting more and more information. These are well-designed trials that will give answers. And we will understand better what, if there is another, there may be a second drug that will show activity. But we have the first step. Now with the vaccine, I think the Oxford team they have been moving very fast, and they're trying very aggressively to come up with a vaccine which is, obviously what will be a game changer. SARS, which was another coronavirus, it was a virus of the same type of what we see now, but that's when it was a few years ago. And at that time, people were trying to develop a vaccine against this SARS virus, which is is like a cousin of COVID, or what we see right now. It's like a cousin. And they had come close to get a vaccine. At the end, they did not do it, because the disease then, for some reason, it went away. You know, it was not, and there was no need to do the final step to get a vaccine. So we really don't know if a vaccine for coronavirus, there is no precedent right now, but this is a very hopeful effort. And there are other teams also that they are trying to do this. So we'll see what will happen. You know, there is no guarantee that there will be a vaccine in the near future. Usually it takes over a year to produce a vaccine. But with COVID, because people are, like the whole world has been mobilized, trying to join forces to come up with something, because it's so distractive to the whole world. One can hope that we will be a little luckier and there will be a vaccine sooner, although nobody knows yet. But there is at least, there are the first steps are happening, you know.
Well, if you watch world news, Dr. Platanias,
Yeah.
that's why you just don't know what to believe anymore. And if you watch BBC, they do say that the vaccine will be available July for first responders, for the healthcare, and then gradually the whole world will be vaccinated. So
Yeah.
if them to be saying something like this, I'm sure they are racing like 300 miles per hour trying to create this vaccine to save the world. Like you said, it's a world epidemic affecting the entire world. So I'm sure that everybody's on board with this.
No, there is. When they say that's, and they have said this timeline, July or August, but that doesn't mean it will work. That's what they want. That's a wishful thinking at this point. They don't have proof that it works, but they are moving fast and they have the hope that they will get there. And now, if you ask other people, this is an overly optimistic thing, because it's one thing to have a vaccine. They can produce a vaccine, but it's another thing to have done a large number of people tested and to know it works. That's the difference between the two. So for sure they will have something in July, but the question is that something that will really work and change things? And we don't know yet. There is no way to know yet.
Dr. Platanias, along the same lines, what do you think about the chloroquine and the hydrochloroquine drugs that have been previously used to treat like malaria and arthritis?
Right.
We're hearing that some people, it's working for them and some people it's not. What do you think?
So there have been no good studies to show that everything so far has been empirical. And there was this study from France that showed that hydrochloroquine together with azithromycin, which is the Z-Pak, the antibiotic that we all use, they were showing big activity. The problem is that this study was not a control study. There was no comparison. It was not good science, that study. And there was also a study from China that also showed some activity, but again, not very well controlled. And then there have been negative studies. There was a study recently from Brazil that just came out that showed more mortality from this drug, So there is no proof at this moment that this drug does much. And it doesn't seem that it's going to be the leading drug. There are still trials going on. The problem with this is that many people started using it outside of trials. And then we, instead of getting to drugs that are on trials and could give us answers. But so far, based on the data that we have seen, I don't think anybody has seen something to suggest that this is a good possibility, that this will be a drug with major effect at least. It may still have some activity, but I think remdesivir is this moment the leading drug. And for sure, if you asked me a month ago whether someone should take chloroquine if they get COVID, I would say yes. What do you have to lose? But now I will not say that. With the evidence that we have, it's not a good idea to take it off a clinical trial, and I will not do it. So I don't think we will see much more from that group of drugs there.
So we just have to wait for those studies. And I think it's interesting that Northwestern is actually one of the groups that is doing the remdesivir clinical trials, right? So.
Right. And it looks promising again. Yeah. And there are also other drugs. This is not only remdesivir. There are other antivirals. There is a study with famotidine right now going in New York. There are other drugs that may emerge. It's just too early so far,
Dr. Platanias, in Europe, they're talking about a drug, if I pronounce it correctly, please guide me, called Casine.
I'm not familiar with that. I haven't.
Okay.
I'm not familiar. There is another drug. Maybe we're talking about the same thing. In fact, there is a drug that the Greeks are trying to do. There is, but that is colchicine.
And they're both trying the same drug. Maybe
You see, the difference is there are two types of drugs for COVID. One is like the drugs that block the virus, like remdesivir, and if chloroquine had an effect that is questionable. These are drugs that are supposed to go and stop the virus. Then there are a group of drugs that are used here that block the immune system. A way people die from COVID is like the virus goes there, infects the lungs, and then there is the immune system of the patient loses, goes completely crazy and starts attacking the lungs. And that itself, the inflammation that is caused by that, can kill people. So there are drugs right now that block this process and are tried. And in Europe, so in the US, we have a drug that blocks the interleukin-6 receptor and looks promising also. But again, this doesn't attack the virus. It tries to stop the immune system from destroying the lungs, And in Greece, they have, and in other European countries, they have started a trial with a drug called colchicine.
That's the one.
Is, yeah. That's it. And that drug is something that we use for gout, actually, believe it or not. It has been used for gout. And the idea came that we don't know if that would be effective, but it's one of the drugs that could have activity, but in a very different way than the rest, you know.
I think we're just all hoping and praying that something works right now, right?
It better, you know, we need, and again, I think science has advanced, and there are many people right now that are working hard for this. So I think one has to be cautiously optimistic that there will be drugs with activity. And the fact that remdesivir shows already a promise is very significant, because at least there is something we know blocks the virus, you know.
That's great. Are there other questions from everyone, related or unrelated?
Yeah, Christine wants to answer.
One more.
Christine?
So we're hearing a lot about how, because we don't know so much about the COVID-19, that there could be a resurgence, it could come back next year. Either way, there's always going to be something floating around that's going to come our way. How do you feel about, I mean, there's a lot of confusion, there's a lot of apprehension. In terms of prevention, how do you feel about requiring disinfection and sanitation of our mass transit systems or at our public places? At least that would slow down anything that's coming down the pipeline in the future. Yeah. There's something to think about. Well, how do you feel about that? And do you think if that's a viable option, if our legislators are even aware that that is something that they should be considering doing?
That's a very good question. You know, I don't know if we should be talking about the resurgence of the virus in the fall, or, you know, the reality is that the virus will never go away. I don't think right now, if we wait another month, the virus will go away. It will not disappear. People talk about post-COVID, and I don't think this thing exists. I think COVID is here to stay. We're going to be dealing with this. The reason for the stay-home orders was to try to avoid the catastrophe that happened in Italy and Spain, in the European countries, where the hospital systems got overwhelmed and people were dying, and they didn't know what to do. They had to prioritize who's going to go on a respirator. So here, this is not happening right now. It happened in part in New York. New York was hit very hard, but the rest of the country hasn't. At least we had in Chicago, this has not happened, and didn't happen in California, in Seattle. So, but still, if you look in Illinois, the number of cases is going up still today. It's not going down. There are some states that it starts going down, but some states that it keeps going up. So what I'm trying to say is that, you know, we will never be COVID-free until we develop good drugs, a vaccine. And I think the decisions of when to open each state, it will depend from place to place. The guidelines, the federal guidelines that came out, have some specific guidelines saying for 14 days to see the virus going down. Some states are seeing that. Some other ones are trying to jump the gun without waiting for that. And I think that's a mistake. But I think the important thing is to have a trend, to know that there will be no new explosion. And obviously the disinfectants of public places, the masks, one important thing that can really help control this is if everybody wears a mask, you know. Then, you know, it's not like you will just be protected, it's that you will not be giving it to someone else. So, and I think right now, that's why now everybody's talking, put at least, if you don't have a mask, put a cloth mask, do whatever you can to protect your, so I think we need to get to a situation that we see the cases going down and people are, you know, learn to live with a mask for a while. And in the meantime, we have new drugs and hopefully a vaccine at some point. And then I think we will see a game change and it could become, you know, something much more controllable. But this virus has been much more destructive than the flu. People say the question whether the mortality is similar with the flu or not. Well, the total number of cases, we have over 60,000 people who died this moment in the US. This is much higher than the flu and in a much shorter time. And it's not the issue of what percent gets very sick. The issue is that this virus is very contagious. Many people get it. Some have very mild symptoms. They don't even know they have it, but some get extremely sick. And we don't know how to predict that at this moment. There is no test that says this person is going to get very sick, this one is not. So it's a very tough situation. I mean, humanity had never had to deal with something so challenging. This is a very difficult virus, you know.
So to follow up on that, Dr. Platanias, when the country reopens, how is Northwestern in the work of trying to prepare for that, and how will they protect their frontline workers and their patients, their cancer patients especially?
Yeah, so you know, there is Northwestern and other hospitals all over the country. They are working, we are all working constantly on what we call reactivation plan. We want to make sure, you know, at some point when the state will lift the stay-at-home order, and right now in Illinois the stay-at-home order is till the end of May. Hopefully at that point it will be lifted. But even now, the state has suggested that some elective surgeries can happen. This is part of the guidelines to the hospitals. So I think we're going to live in a new era. What we realized during the COVID period is telemedicine, you know, this concept that we didn't have before, seeing patients over like we do now, and reviewing stuffs with them. And, you know, you can do a lot of things. The only thing you cannot do is a physical examination, you know, but you can learn about the history, discuss symptoms, write the prescriptions. You can do many things. So I think some of that stuff will stay. We will still try to minimize. We don't want to have very dense environments, you know, with many people coming together. And we obviously are maximizing the protective equipment from the doctors, precautions, you know, masks, avoiding interaction. So all these things will continue. There will be a lot of, and we keep learning. Don't keep in mind that 2 months ago, nobody knew that this virus can be transmitted from asymptomatic individuals. Everybody thought it would be people with coughing, or now we realize that this can be from people without any symptoms at all. And that's why it's important for everyone to have a mask or something when they get to crowded places. So there are still things to learn, but I think we start understanding better and better how this virus spreads. And I think when with a gradual opening, that has to be done safely, because if it is done abruptly, it can have the opposite results, you know. Things can close down again. There is actually a city in Japan that they did that, they tried to open very fast, and then the things got so bad that they had to close again. Wow. So, you know, so it's a very complicated process, but I think the experience that many hospitals have gotten, states have gotten, will help to have a more gradual and safe reopening, which is important, of course, for everyone. So.
That's great to hear that Northwestern's thinking about that.
Oh, absolutely. Yes, yeah. Totally. Yeah.
Are there other questions?
Guys, can I ask you a question, please? Seems that I have questions with Nicole. I wish everybody will join in and just ask
questions. Please, just ask a question, you know. Valerie, please unblock everyone so everyone can ask.
Everybody can
join in and ask. If I can ask.
I have a question too.
Let Eleni ask first and then Costa. Okay. Eleni.
Dr. Platanias, yesterday there was a big controversy between all healthcare and the federal FDA. They were saying that for decades, medicine.
It's in the bag over there.
I can't hear you, Eleni. You get interrupted. Valerie, can you, when someone asks the question, block everyone and then unblock again? So Eleni, would you please repeat? We couldn't hear here.
Yesterday there was a big controversy with the healthcare. They were wondering, they were saying.
Hold on, she's not. Give her a second to fix it because we still cannot hear you.
Can everybody hear now, everyone?
Yes, now we can hear you. Yes.
Question. Yesterday, there was a big controversy between the healthcare and the FDA. There was numerous questions asked. Why is it that for decades, you professionals have told the FDA and the government that they should improve their research on various viruses, since there is so many new viruses coming up? Where do you think that loophole is, and why isn't that they're not listening to what you professionals have to say? When
You know, it's a very complicated thing, and I really don't know the details at the government level and the FDA, what's going on. But right now we are where we are. I really don't know the details and what's going on there. But the point is, right now we're at a certain point that I think everybody recognizes the problem and tries to work together to address this. So this virus was a little bit surprising because it was is a very different virus than we have ever seen. You know, we never had a pandemic since the time of the Spanish flu in 1917. So that gives you the idea. This was like totally, was a big deal. And the other viruses that we had before, we had some serious epidemics with Ebola or with H1N1 flu. They were controlled very well and much more efficiently, but they never got to the degree that we see now. You know, it was much easier to control these things. So I think this is everybody's learning right now how to deal with that. And I think in the future, the better all of them get prepared all over the world. You know, this cannot happen again. It has been very damaging, you know.
you want to open that up to everyone?
Yeah, Costa, you had a question? Can you unmute yourself, Costa? Okay, yeah, unmute yourself.
Yeah, I want to ask, Doctor, are there any special advice or measures for people who already had or are still going under some kind of chemotherapy treatment, or people who belong to high risk group, how they should expect to live their lives, let's say, for the next 2 years?
That's a very good question. And they will have to be extremely careful. First of all, they will need to be in a communication with their doctor and discuss how they get the chemotherapy, where to go, try to do it under very safe, conditions. And that's what the cancer centers do. They try to minimize the risk for people who need to come in and get chemotherapy. And I think we have been doing a very good job at this. We have meaning decreasing any possible risk. But the question is, as long as now, even if things improve, as long as there is still some virus around, people who are immune compromised or they get chemotherapy, they will have to stay very, very, and there will be more guidelines by the government and by the states, but they will need to protect themselves more than others. And, it remains to be defined exactly the level, but probably what we live right now, even if there is some reopening, people who are at higher risk will need to continue for a longer time and avoid exposure because, the risk is much higher there. So it's hard to predict for how long this will go, but definitely will go longer than when it reopens for let's say we reopen and some people can go back to work. People with who are very sensitive will have to continue to protect themselves.
Okay, as a follow-up question, let's say, for example, someone who, an adult who is a high-risk group for a hematological disease or maybe from a transplant, if his work is, let's say, in a high-risk environment, like going to courts or jail, and if a kid with also the same high-risk hematological environment, so they go back to school even if the schools are open? Or
well, I think this has to be evaluated on a case-by-case basis. And I think they will need to discuss that with their doctor in detail, because in some cases it may be okay if they have been treated and the disease is gone and they don't, they're not very immune, it may be fine. But in some other ones, if they're getting active treatment or, it could be not fine. So I think every case is different and will have to be discussed and evaluated on a case-by-case basis with their doctors,
But high-risk groups, they have to take it very seriously. And
Absolutely, absolutely. And until, as long as there is COVID around and significant numbers of COVID, and they will have to, and that's actually what the experts say, Dr. Birx and Fauci, they keep saying about that when the country reopens, there will be a group of patients who will probably need to stay at home longer. But that needs to be redefined yet. There are no clear guidelines at this point, so.
Can they unmute so everybody can ask questions?
Yeah, let's unmute them.
Doctor, it's Pete Carajalios. A
Peter,
basic
hi.
question and a follow-up question. Since it appears that this virus really attacks the lungs, is it a good idea for people who are at risk, for example, people over age 65, people that have got compromised immune systems, to get a pneumonia shot? That's my first question. The second question is a patient who has had pneumonia, will they fare better than a person that has not had pneumonia in the past?
That's a good question. So the pneumonia that people get, like the pneumonia shot, the shot for pneumonia is for a bacteria, it's not for a virus. It's for a bacteria called pneumococcus. So this shot doesn't protect at all from this virus. And it doesn't protect from any virus, actually. It just protects to this specific bacteria, which is a different thing. So the pneumonia shot is good to get it in general, but it will have absolutely no effect in protecting from the virus. Now, the question, if someone had a pneumonia in the past, whether this will help protect them from the virus, the answer is no, it doesn't, because the pneumonia usually that they had was, again, from a bacteria. It could be different types of infections, but it's usually not a virus. And and they can be infected even with the bacteria, again, with the same thing. So this will not protect, unfortunately, it will not do anything against the virus.
Thank you, doctor.
Yeah. This infection that this virus causes in the lungs is very unusual. Like the flu sometimes does this, but much less, not nearly as much as we see with COVID. So, and that's the most fatal complication of COVID, going in the lungs and infecting the lungs, and it causes a lot of damage there. So, unfortunately, there is nothing else that happened before in the lungs that can protect from that. Someone is asking, who is, I don't know who is asking. Valerie, can you say?
I don't know who is trying to ask a question right now. I will unmute everyone for a moment.
Yeah, let's unmute them. Yeah.
Can you ask Dr. Platanias who's trying to ask you a question? So, can you unmute everyone so they can hear?
I've unmuted everyone, but they have to accept my unmute.
Yeah, no, if
request.
whoever is talking, there is, I don't think anybody, I think someone was talking internally. There wasn't a question really.
Doctor, I want to ask you, I heard yesterday that the first symptom in England for some kids was stroke. Is there
Was what? A stroke, you said.
Was stroke, yeah. Is
Not-
there?
So the stroke, this business with a stroke, that there have been some young people who just present without any other symptoms and they just get a stroke, people in their 20s, 30s, which is a horrifying thing if you think about it. very, very unusual. And the reason this happens is because this virus goes and affects the way the blood is clotting, you know. We are reviewing right now, we're trying to write a review on the hematologic effects of the virus. And it does something very unusual. It creates, there is a process, it affects something that in some people, not everyone, it can create these clots. And usually that's part of the disease with other symptoms too when that happens, especially in the lung. But it looks right now, which was very surprising, again, this virus comes up with completely unpredicted effects. And there are a group of young people who present just with a stroke. So that's very worrisome again. And the good thing is that, of course, that is not very common, but it can happen. And again, it's a very unusual, viruses don't do this type of things usually. This does. So.
I have heard some experts who call it, instead of a coronavirus, that they call it a disease, that it's a system of things because it affects also other parts, other organs.
Yeah, it affects many parts. I mean, it affects the lungs, it affects this blood clotting, it affects the kidneys. Many patients lose their kidney function because of the virus. It affects the heart. There are patients who have heart issues. There is some suggestions that may have effects in some people in the brain too, although that's not clear. There are some patients who present just with GI symptoms, you know, the diarrhea and stuff. At the beginning, but now we know it can do that. And it does also some unusual things. Some patients have the only symptom losing their taste or the auspicy, like, you know, yeah, the smell. So it does many, you know, we're still learning. It's a new virus, so, but it has a very broad spectrum of presentations.
Do we know when we expect the second impressive somehow presence of that virus?
I don't think anybody can know. I mean, I mean, there is a worry for the fall and the winter because, especially because it's the flu season then. You know, this virus doesn't seem to be so seasonal. So it will still be around in the summer, but it will probably go down, maybe, because of what we do, it will go down a little bit. But then in the fall and the winter, the flu will be back and the virus will be still there. And that's the worry, you know, because the flu has its own mortality if people don't pay attention. Now, there is this theory that because of the attention that people now paying for the coronavirus, like washing their hands, wearing masks, avoiding crowds, that we will see less of the flu. It's very likely that this will happen. And that's, so hopefully nothing really dramatic will happen when the flu comes back also. There is, by the way, an unusual, some patients can be infected together, both by the virus and the flu. That has happened, it can happen, so.
Dr. Platanias, can I ask you 2 questions, please?
Yes, please.
Does UV light, ultraviolet light, be used to kill the virus? Does it help kill viruses?
Only helps on surfaces. You know, it is UV light. We use it also in the lab to, you know, when we do experiments, we have the hood and we don't want them to get contaminated. And you can put UV light to keep it sterile. But that's only for surfaces, it's not for humans. So it's a way to sterilize things like we have other, you know, ways to sterilize.
Okay, the question that I want to ask is the percentage of people that die, and of course, you know, a lot of people are losing their loved ones and it's tragic because they cannot be with them. And I mean, they have to say goodbye over a phone call or FaceTime, which is very tragic. Do we know what percentage of those people had a pre-existing condition? Because you get tired of, I know for a fact, many of my friends had loved ones that passed away, and they're very angry at the fact that they document them as dying from COVID when they know they died from some other illness.
So, that's a good question. Here is the story. First of all, there are some people who have pre-existing conditions are much more sensitive to COVID, and they may, and that's the risk. They die from COVID because their immune system cannot fight COVID. So although they have the other condition, it's probably correct if they were testing positive for COVID, COVID was the cause of that they die. Although they may have something else. Interestingly, there are some conditions, like for instance, many patients who die have conditions that are not that serious, like high blood pressure. There are many of the people who die have just history of high blood pressure, which is many people have. So, and we have seen also many doctors have died from COVID. If you go, healthcare workers seem to be more sensitive. If you go, worldwide, especially in Italy and Spain, and also in the US, there are people who have died without pre-existing conditions at all. So I think in general, the presence of COVID together with the pre-existing condition is usually, if they have symptoms, it's probably the COVID that led to that. And they could have survived despite the pre-existing condition. But it's hard to know all these things. It gets a little, but keep in mind, there are people who are completely healthy and have died, including young people. It usually happens to older people, but there are people in their 50s, 40s, 30s who have died without pre-existing conditions. And that's another thing to keep in mind here.
Doctor, can we say with certainty when the vaccines they're going to be available, they're going to be safe? When they
no, we cannot. I mean, the hope is that because everybody's trying so hard that it will be faster than usual. Usually it takes more than a year, at least a year, maybe a year and a half for a vaccine. But in this case, the whole world is pushing hard, and hopefully it will happen faster.
Let's pray that it does. Is there anyone else that would like to ask a question?
Well, I just have a bigger concern too with the pandemic, which is the mental health component as well as the domestic abuse of how that we're all focusing on data and information, and we understand one's physical, but the mental is not really. I don't know how information like that's being captured and understanding how that's going to be impacted and certainly affect the medical professionals going forward.
Thank you for bringing that up. Actually, in our cancer center, we have a whole process to support psychologically our patients as they're going this. We have working groups, there are support teams they can call. But what you say is so important, because yesterday, I don't know if everyone else noted this, but a doctor, she was 49 years old.
New York.
In New York, she was the director of the emergency rooms, and she committed suicide after working very hard in a COVID ward, COVID emergency room. She got infected with COVID, and she was overwhelmed. And so there are doctors that the stress is very intense, and especially for healthcare workers and patients, of course, can be really devastating. And we have things like that. So that's something else that gets more and more attention, and you need mental support. It's a very tough situation. And, people are not used to operate under such high stress. So that's an extremely important point, and thank you for bringing that up.
I'm glad that somebody brought that up, Dr. Platanias, because everyone is focusing on trying to, of course, find the vaccine, trying to find the drug to block this horrible virus, like the Remdesivir, but no one is really focusing on the psychological, mental of, first of all, the first responders. They are in the front line. They're seeing people drop dead in front of their eyes without any pre-existing conditions, like you said. And second of all, no one is addressing the suicide. I mean, tragically, when everyone, I think the whole world heard about this prominent ER doctor at 49 years old who came from a very prominent medical background from her parents, if I recall right,
Yeah.
commits suicide. And then the domestic violence, the increase in suicide and violence, it seems that no one is addressing this multitude of an impact that the COVID-19 has had on society.
No, that's a very good point. It has a much more widespread impact. It has also what we call collateral damage.
Right.
There are other patients who may have something serious and they don't go to the hospital because they're afraid of COVID. And again, is what I say, at least for cancer, we should not let fear for COVID make cancer win, you know? So that's why we want to make sure, and we call our patients and we try to coordinate to make sure that they follow their appointments when they need to, when it's needed. So it's a balance of things. It's from the psychological part, other diseases, and then dealing with COVID. It's difficult, you know.
Dr. Platanias, are a lot of your patients with cancer afraid to come to the hospital and to get treatment? Do you see there is a lack of activity?
It's 5 o'clock.
What's that? Valerie, what was that? We know.
I think the meeting was originally scheduled from 4 to 5, so that was a Zoom automated message. I'm sorry.
Probably gonna cut it
The
off.
Zoom police.
I have,
Is this
So,
a union
so-
shop that you have over there? What's going on?
there you go.
It sounded like it was the voice of God.
Is there a fear of your patients? Is there a fear of our cancer patients reaching out to their doctors to come to the hospital and to get treatment? Because I know for me, I want to come and see my doctors and I'm afraid because all of you carry me, don't come, don't bother coming, just stay home.
So you know, that's why we. Valerie, do something. Okay. No, that's a good point. Some people are afraid, and for patients that. Is that the Zoom again, or what?
Yeah.
No, I'm sorry. That's coming from Galenis's phone. I keep muting it.
Okay. So no, yeah, you know, that's why we try to communicate with patients that we know to make sure they come to the follow-up. And again, it's important not to let the fear of COVID, you know, block the real treatments that we need. Some cancer treatments can wait a little bit, and or they can be done from distance. We have modified a lot of things to make it safer. But, you know, for people who have serious health problems, they should not just decide and say, oh, I'm not going to go. They should call the doctors and discuss it, okay? And, you know, I mean, people who don't have many serious problems is a different thing. But for serious stuff, you need to talk to the doctor, you know, so at least there is some communication.
Okay, guys, don't listen to him because he called me telling me, don't you dare get out of the house.
Yeah, but I didn't wait.
I have a question.
Yes, go ahead. Who is that?
So, Teddy, so today, Governor Pritzker said that he's going to start allowing people to go for non-essential procedures again. Do you think it's safe for someone to have an elective surgery now? I mean,
Yeah,
like our hospitals here in Glenview, you know, Glenbrook South is the COVID hospital for North Shore. Would you go there for a procedure?
I personally, I wouldn't, North Shore will not be my preference for good reasons, but independently of COVID, I work somewhere else, as you know. But I think if there is, you know, the elective procedures, and that's happening across the state right now, people coordinate, and this is done under controlled circumstances. And I think it's pretty safe to go for some elective procedures. They prioritize what elective procedures. There are some surgeries that are significant, but they were not very urgent. That's why they held them. So gradually, we need to get back to the point that if you need surgery, you get surgery. And you cannot do that, unless you go gradually. So what the state is doing, giving these guidelines, is very good. It creates guidelines that make it easier for the hospitals to start operating. But we cannot forever stop doing surgeries because of COVID. We have to deal with, we just have to do it in a safe way, gradually. And as we learn more, to do it safely, and effectively.
I have a quick question. Hello, everybody. For Dr. Platanias, this is Patty. There are a few states that did not go on lockdown. And of course, we know about Sweden that's not on lockdown. Can you comment on that? I mean, there seems to be not as many cases.
So if you go and look at Sweden, I pulled the data the other day. If you compare Sweden to the other Scandinavian countries, their neighbors, Sweden is doing much worse. They have much higher death rate. People keep bringing Sweden because they did something different. I don't think what they did is a good thing, and I don't think there is any evidence at all that what they did is good. They just sound like, and the data, if you look at the data, I'm trying actually to pull them out. I don't know if I can put them. I have in front of me right now. I wish I can put it, but there is, if you look at the death rate in Sweden, is at least 4 or 5 times more any other Scandinavian country. So it's not a good example. Now, the states that are going and doing things, I strongly disagree too. I think they're making mistakes, but we'll see. Now, everybody is different. One example that I think is not good at all is Georgia, because that's a state where COVID is still going up. It's not going down. At least in Florida, it's going down a little bit. In Georgia is still going up, but we'll see. Who knows, But I personally think is a difficult thing to stay at home. Nobody wants to stay home.
Right.
All of us hate that. But there is evidence that it has worked. At least in many places, it has worked. And we have gone all this way through right now. You don't want to lose what you already won. But we'll see. I mean, some of the states don't have many cases. Right. And it's not like it is extremely. It's not like opening New York or Chicago. So it's probably safe in some places with very little incidence. But there are some examples, again, it's very variable. Some of them still are going up high and they're opening. I think the problem, in my opinion, the worst example is Georgia, but some other states that are opening are not so bad. So we'll see, It's hard to predict.
Thank you. I was just going to share something with you just because it's a good point of note. So my mom had sepsis and it was mandatory. An ambulance picked her up and she lives in northern Brevard County. I think we're lucky that it was in northern Brevard County as opposed to Dade County by Miami or Fort Lauderdale, because there's not as many cases in North Brevard, and she was quarantined and locked up for 14 days, which scared us because of 86 years of age and being an immigrant, not being able to communicate with her in a hospital that was under lockdown was very scary. But statistically, looking at where she could have been transferred into, she transferred into an area that we were looking at the data. And with the tests and the information that was available to us, we realized, okay, there isn't that many cases. I think there was 8 cases in Titusville, where Kennedy Space Center is. And she got unbelievable attention, and she had IV drips for the last 14 days, and they just released her. But it was a very scary situation, especially because they don't have iPads.
Yeah, that's a good example, I think Zoe got frozen.
She's a fighter.
Yeah, that's amazing.
The fighter.
Worried about what that meant. Very scary situation. That's a big deal. Is
I'm
where
so
you're
glad
getting.
she's doing well. That's great to hear that she's doing well. So
Yeah.
Great. There is a lot of research going on, and we do a lot of research at Northwestern, and let's see what happens. You know, we have to stay optimistic, and I think overall things are moving the right direction slowly. But you know, just we have to keep protecting ourselves. Everybody has to do that. You know.
And Dr. Pat, I have to say that not that we're Greek. I'm not saying that because we're Greek, or you know, you, me, a couple of us. I'm saying that for a small country like Greece, it has taken so many precautions. And when you see a country that goes around and disinfects even little villages, no man's land, where no one could even find those villages. And I saw on the news, they're even disinfecting those small villages. What in the world is going on with us as a country that we're saying that we're the most powerful country in the world and we don't disinfect? You see China, before they opened up, they disinfected everything, even their sewer systems.
You are so right, Eleni. Yeah.
Why can't we not disinfect and let's get people out there? We cannot keep people hostage. Like you said before, the hospital's got to open up. The doctors have got to do their surgeries. People have got to go in for their surgeries. I mean, the world has got to move. We cannot be stopping to a virus and think of the worst. We have to be very optimistic. But why isn't everyone, and to start with the healthcare, to say, you know what, everything has got to be disinfected for us to.
Yeah, don't keep in mind that Greece, you know why Greece is doing incredibly well. And I think the Prime Minister of Greece, who is a very smart guy, trained at Harvard, he did something.
In America.
What?
He was trained and educated in America. I mean,
of course, yeah, at Harvard. He's a very smart. And what he did, he went and he shut down Greece 2 weeks before the other European countries. He has another infectious disease doctor that works with him, also trained in the US. He was in Philadelphia. Yeah, yeah. And yeah, he went and he shut down Greece 2 weeks before everyone else. And that made a huge difference. You know, you see right now, Greece has become like the top country in Europe without infections. And that's amazing, you know. Now, they do the disinfections and all that stuff, but you see they're still in lockdown. They will open faster than others, but that's the whole point. You know, you can disinfect. In China, they were going around all cities and were disinfecting. And there is disinfection going on right now. If you come to Northwestern, all the labs were disinfected with various things. But that's not enough. You know, you need to stop the transmission, the human to human. And that's why the stay at home is important to do it up to the point that we see the curve turning around. And this is happening in some states right now. Clearly it's happening. In California, actually, it's happening big time. And despite that, the governor, and I think he's doing the right thing, he's trying to push to go a little further to make sure they will really go. So each part of the country is different and they do things differently. But we need to be patient and follow the stay-at-home orders. Otherwise, this thing will keep coming back. You know, we all want it to open, but I agree with you. Going around sterilizing is extremely important, you know.
anyone else questions? Let's go. This is your chance.
Nicole, you have been very quiet today.
I mean, everyone's been doing such a great job, but if there's no more questions.
I have one last one.
Go ahead.
Yeah. Yes, please.
So I have 3 college students, one going in.
Sorry.
What is the criteria? Have you heard of what, when the schools will open, the universities?
I have no.
The determining factor, the curve, probably?
Yeah, I think I don't want to say anything there because I have no idea about the schools and universities, but clearly that's part of the whole thing. It looks like until the summer we will be closed. So it's going to be the next academic year, right? And I don't want to say anything because I really have no idea. That one, I think is going to vary again from state to state and region to region. I don't think there will be you know, a national thing. So.
Are there any more questions? Okay,
Appreciate your time. Thank you.
So if not, this concludes our week 2 COVID Talks with Dr. Platanias. Thank you for being here. You obviously enlightened us. I think the biggest thing was that you motivated each and every one of us to think about our own individual plan when the country reopens. I think all of us have to evaluate that for ourselves. I want to thank, again, thank you for taking the time to be here. I want to thank HCRF for being here. I think it's so uplifting to see us all together. We're all here because our hearts are in the same place. COVID and cancer matters to us, and we want to make a difference. So
let me just say a thank you from me. If any of you have any medical questions for you, if you need help in any way, you have my cell phone number. It's 312-933-7924. Feel free to call me anytime if I can help. Don't hesitate at all, okay? And I hope everyone stays safe, and thank you again for your support and everything, okay?
I have to contest to that. Dr. Platanias, no matter where he's at, anywhere in the world, if you call him a question, he will pick up the phone. It can be 3, 4 o'clock in the morning. One time he was in Switzerland. He was about to give a speech. And I'm like, Dr. Platanias, and I go, where are you? He's like, I'm out of the country. And I go, oh my God, bye. And thank you, Platanias. Thank you for always picking up everyone's phone calls. As you said one time to me, which I will always cherish in my heart, you said, I took a Hippocratic oath, and that is to serve others, not to serve myself. And that is a true testimony to who you are. And
thank you.
That's why the Hippocratic Cancer Research Foundation is very successful, because there was a lot of people who believed in you, believe in Northwestern, believe in your incredible team of researchers and incredible physicians and scientists that are on board with you. And it's truly an honor to raise funds for you, so you guys can eradicate, hopefully one day soon, cancer. And now we did send out an appeal letter. We want you to know, I think it's the first time that I'm saying this to you, asking everyone to please be generous in sending a donation for the research that you're doing on COVID. COVID is affecting all of us, and it's affecting our families, our friends, and it's affecting the entire world globally. I always tell everyone, you don't have to be genetically connected with someone. We are connected through God. And through God, we are all made in His image. Therefore, we should all support, love, and care for each other. So if we can help you, HCRF, I'm speaking on behalf, I think, of everyone, is so proud and honored to help you and your team against the fight of COVID and, of course, cancer. So if there's anything we can do for you, I know we supplied you with masks. I deeply thank everyone that participated. We supported the entire research center with masks, Lurie's ICU with masks. It was truly a privilege to be a part of that. I know that everyone on the HCRF is entirely generous. Everyone wants to be a part of impacting the world, impacting change. And I am truly honored and blessed to have everyone on board. I hope we will November to have the gala. Pray. That's why I will kill you if you don't fight the vaccine. We need to have the gala. We need to have the momentum. We need to inspire everyone. We need to give people hope. I honestly believe in my heart, through this crisis and through this pandemic, people have lost faith. They've lost confidence. They're angry. They're anxious. Of course, we are all blessed that we live in beautiful homes. We don't have to fight with financials. We don't have to fight how we're going to support our children, how we're going to pay the rent. And it's heartbreaking what's happening in the world. So if we can be a part of this change and a part of saving, even one life, I think there will be a great legacy to all of us.
Thank you, Eleni, for your leadership and for humanitarian work. This makes a huge impact. It is an honor to work with you. And thank you, everybody in the board and HCRF for your support. Thank you.
We look forward to seeing you next week, Dr. Platanias.
Okay. See you later. Bye-bye.
Thank you.